Hello, everybody. This is my practice run for my expository speech. The topic I have is psychedelic therapy. I'm gonna start off with a little story. The other day, I was at the park and there was this two people, specifically a woman. I thought she was a family member, so I was like, "Do I know you?" And she didn't give me any response. She started to quiver and uh, she was holding like a beer, and I always would look at her and she would always have a beer. Uh, um, it was her, the person she was with was like, oh, I'm sorry, I don't think you guys are related. She suffers from anxiety and she's like that a lot. I was like, oh crap. So I was like, well, this was actually a while ago. I don't remember if I recommended her to do psychedelic therapy or not. Maybe she did, but um, uh, yeah. So I think that's what motivated me to do this speech on this topic. So I have some stats here. According to Healthline.com, scientists produce a bunch of evidence verifying and pointing towards the therapeutic potential of psychedelic therapy to treat addiction and mental health conditions. And according to the National Alliance of Mental Illness, 1 in 5 Americans experience mental illness. So it's safe to say that there's over 6K people who have experienced mental illness here in Stockton. Um, so we're going to learn about psychedelic therapy. We'll be discussing what psychedelic therapy is. We'll be discussing what it is, how it works, and the implications. Um, so first, let's discuss what therapy does. According to Psychology Today, it states therapy can be called psychotherapy and also talk therapy. Uh, the site defines therapy as a form of treatment aimed at relieving emotional distress and mental health problems. So that's just ordinary therapy. And I have some stats about uh, therapists here in America. According to my Denver therapy site, uh, about 30% of American adults have seen therapists. 42 million people receive some type of treatment for their mental health in 2021. About 17% of American teens see a therapist each year, and 20% I haven't memorized these, so of working adults experiencing mental health issue, around 25% of women have received some form of mental health treatment in the past year. Um, and now some facts about the therapists working here in America. Um, there are over 200,000 therapists and 80,000 psychologists practice in the country. About 30% of them are men and 70% are women. The average age of a therapist is 41 years old. So now we can start talking about a very controversial type of therapy. The type is psychedelic therapy. Now, according to the National Library of Medicine, the title refers to psychedelic medicine as a re-emerging therapeutic paradigm. It continues to state that renewed investigations are taking place in the use of psychedelic substances uh, for treating mental health illnesses, including addiction. These renewed investigations are the first since the termination of a period of research ranging from the 1950s to the early 70s. These psychedelics include LSD, psilocybin, ayahuasca, MDMA, and there's more. So we discussed what psychedelic therapy is. Let's discuss how it works. There's a site. There's a there's an article called "The Therapy Part of Psychedelic Therapy is a Mess." It pretty much states that if you're interested in doing psychedelic therapy, it will look something like this. You'll be in a room with psychologists or therapists, and they will help you. Um, they'll help you after you after you swallow a dose of a psychedelic drug, and then you lay back on the sofa just hanging out pretty much. And they say the therapy component of psychedelic assisted therapy isn't being studied enough, and it could be a risk. So, um, we discussed the therapy component of psychedelic therapy, so let's discuss the actual psychedelic part. According to technologynetworks.com, a study shows psychedelic drugs rewire the brain. This the study was on LSD and psilocybin, which reveals details about how these ingredients bind to receptors in the brain and how they exert their antidepressant effects by binding to receptors for the molecule brain derived a neurotrophic factor, abbreviated MDNF, an important agent of neuroplasticity. And neuroplasticity is defined as a process by which the brain connections reshape and form new connections. So that's how uh, it can help rewire your brain. So now that we discuss how it works, let's discuss its implications. As we mentioned, psychedelic therapy is referred to as a re-emerging theoretic paradigm. According to the same article published by the National Library of Medicine, most psychedelic drugs are classified and legally scheduled as having no or very limited medical purpose. Um, and a risk associated with psychedelic drugs is HPPD, hallucination persisting perception disorder, sometimes known as flashbacks. The incidence of adverse effects such as psychosis or HPPD is relatively low and usually associated with the use of procured psychedelic substances. The most common adverse effects from the administration of psychedelics under clinical supervision are limited to the time of action. These effects include increasing anxiety, fear, heart rate, and blood pressure. And without careful supervision, fearful responses could lead to dangerous behavior. So, my conclusion is today we learned about psychedelic therapy. We talked about psychedelic therapy, what it is, how it works, and the applications. Uh, Remember, 1 out of every 5 people in America have experienced mental illness. And to that woman in that story in the beginning of my speech, I haven't seen her, but I hope she found some sort of treatment for her condition. So yeah, this is the end of my speech.